Hey everyone, welcome back to the channel. Von Willebrand disease is the most common inherited bleeding disorder. It's caused by a deficiency or dysfunction of von Willebrand factor. This condition affects platelet function and also disrupts factor VIII stability, leading to abnormal bleeding. Von Willebrand disease is the most common inherited bleeding disorder worldwide. It affects up to 1% of the general population. However, many cases remain undiagnosed because symptoms are often mild. To understand this disease, we must first review normal hemostasis. The first step is platelet adhesion to a damaged blood vessel. Von Willebrand factor connects platelets to exposed collagen and stabilizes factor VIII in circulation. Von Willebrand factor is a large multimer glycoprotein. It's produced by endothelial cells and megakaryocytes. It's stored in ribopalade bodies of endothelial cells and alpha granules of platelets. Von Willebrand factor has two major functions. First, it mediates platelet adhesion by binding platelet glycoprotein 1b receptors to collagen. Second, it carries and protects factor VIII from degradation. In von Willebrand disease, platelet adhesion is impaired. There is also a secondary decrease in factor VIII levels. As a result, patients develop mucocutaneous bleeding rather than deep muscle bleeding. Von Willebrand disease is classified into three main types. Type 1 is a partial quantitative deficiency. Type 2 is a qualitative defect. Type 3 is a near complete deficiency of von Willebrand factor. Type 1 is the most common form of von Willebrand disease. It is usually inherited in an autosomal dominant pattern. Patients typically have mild to moderate bleeding symptoms. Type 2 von Willebrand disease is caused by qualitative defects in von Willebrand factor. It has several subtypes, including 2A, 2B, 2M, and 2N. Bleeding severity varies depending on the subtype. Type 3 is the most severe form. There is a near complete absence of von Willebrand factor. It's inherited in an autosomal recessive pattern and can resemble hemophilia clinically. Patients typically present with mucocutaneous bleeding. Common symptoms include easy bruising, bleeding after surgery or dental procedure. Platelet count is usually normal. Bleeding time is prolonged due to defective platelet adhesion. Activated partial thromboplastin time may be prolonged because of reduced factor VIII. Diagnosis requires specific laboratory tests. These include von Willebrand factor antigen level and activity testing using ristocetin. Factor VIII levels are also measured. Treatment depends on the disease type and severity. The goal is to control active bleeding and prevent bleeding during surgery. Not all patients require regular treatment. Desmopressin is the first-line treatment for type 1 von Willebrand disease. It works by stimulating the release of von Willebrand factor from endothelial cells. It's ineffective in type 3 disease. In severe cases, von Willebrand factor concentrates are required. These products contain both von Willebrand factor and factor VIII. They are used in type 3 and severe type 2 disease. Von Willebrand disease is the most common inherited bleeding disorder. It primarily causes mucocutaneous bleeding. Accurate classification is essential because treatment depends on the subtype. Thanks for watching. If this video intrigued you, don't forget to like, subscribe, and join me next time as we uncover more mysteries of medicine. See you next time.